Ready? Here we go. Yeah, that was semi-coordinated, right? All right, ladies and gentlemen, good morning. Happy Tuesday. Are you looking for secrets to pain-free training? Then stick around today. You're going to want to watch this video because today our head coach, Brendan Fox, is going to be answering all of your questions. And if you stick around to the end, you are going to get a powerful takeaway that you can implement with your clients. It's so exciting to be here with you on a Tuesday. We're right before Christmas time. You can see I have my festive hat on today. Brendan, how you doing today?
Amazing. High 10, everybody. Join me right now if you're there. Positive energy exchange. I know this is COVID and we all got to keep physically separated, but our positive energy can go beyond those bounds. So sending some to all of you.
Awesome. So if you're joining us live today, please say hi. We want to see who's out there. So throw a wave emoji in or just say hi. We want to see everybody out there. And we know we have a bunch of exercise therapy students, who are exercise therapy certified, that are going to be joining us today. So if you have your ETA level 1 or level 2 cert, throw a heart emoji into the chat, into the comments for us so we can see all of our ETA certified people. Awesome. So we've got Joanne there. We've got a couple of other people joining us. That's awesome. We also want to know where you're watching from. So we have people that tune in from all over across Canada. We have people that are tuning in from the US and from Australia. So give us an indication of where you're watching from, and put your city or put your country into the chat there so we can see where you are all watching from. Okay. All right. So we've got Tim's joining us, and we've got a few more people with emojis getting in there. That's awesome. So hi to Tim and David and Joanne and all our ETA people. Amazing. Niagara Falls, someone's watching from. Kitchener. Got a lot of different people in there. So that's absolutely awesome. Now, as we get started here, guys, if you have a friend or a coworker or a colleague that's a fitness pro that wants to be a pain-free trainer, that wants to specialize in creating pain-free clients, please share this stream with them right now. So share this stream into their news feed or tag them in the comments so they'll get an alert and they can jump on and watch this too, because today we're going to help you with pain-free training, and there's probably some colleagues and coworkers of yours that would benefit from today as well too. Okay, so just tag them in the comments or share it. All right, so we've got Matt. Hey, Matt from Kentucky. Nice. Thanks for joining us. We appreciate it. Okay, guys, so I'm going to introduce Brendan. Most of you guys know Brendan, our head coach, because you've interacted with him in some capacity, but there's a few new people out there. So I want to share Brendan's bio with you guys. Brendan is our head instructor at the Exercise Therapy Association. He has been in the health and fitness industry for over 18 years now. He graduated from Laurier University with a degree in kinesiology, and he's worked many years at a medical clinic alongside doctors, helping them solve the toughest injury cases. So he was often referred many of the clients from the doctors when they needed his help in getting to the bottom of aches, pains, and injuries. And then he took everything that he learned and he applied those systems for getting people pain-free and fully functional to Olympic gold medalists, pro athletes, and all kinds of high-level performers. So not only did it work in those cases of injuries, but it also really worked at the highest level of competition and sport. He is an international presenter. He's presented at many different conferences internationally and been a guest star on television like Breakfast Television, TSN, and a lot of different other spots as well too. So that's a little bit about our head instructor, Brendan Fox. And so Brendan, are you ready for Christmas? That's the most important question today.
I've been celebrating Christmas twice a week, every single week, because it's COVID. Okay, once a week with my family, we celebrate Christmas every single week. We watch the movies, we do a big dinner, and then once a week with friends. So I'm in Christmas already. Like I am celebrating twice a week already. And I encourage you to do that as well. I think we all deserve that. been a weird year. It's been uncertain, difficult times, but we can always make the best of it. So I'm really maxing down on Christmas. Not as much as you on this call, though, Jeff, with that hat. You win the MVP in Christmas spirit today.
Yeah, so I wear my Christmas hat, in the month of December because it's really the only time you can get away with it, and so I'm excited about it. It's awesome. I love that you're in the Christmas spirit, doing 2 days a week, Christmas winning. Love it. So we're gonna dive into our pain-free Q&A. We had some people send in some questions ahead of time, but we're also going to be taking some questions from the chat. So if you guys have follow-up questions from the chat, let us know as we go through today's content. And we want to definitely address your pain-free Q&A and all the time that we have today. So our first question today, Brendan, was from Kyle. Kyle sent us a question that says, what causes a weak serratus anterior or creates a lack of serratus anterior interaction? And what lifestyle factors lead to a lack of serratus function?
Okay. First of all, that's a really intelligent question. So kudos on asking such a great question. I think it's actually 3 questions in one. So depending on how detailed we want to get with this, I can kind of break it down for everybody in terms of how I look at the serratus anterior and the strategies I've found success with. And it's an area I've studied intensely. I've studied textbooks on it, taken courses, and many thousands of hours on trying to be like 10 out of 10 on dealing with serratus anterior issues. And I found some really cool stuff that I haven't really talked about in any of our courses or anything like that before, but I'm happy to share some of that with everyone who's on the call today. I see there's even somebody from Northern Italy here today. Io capisco po' italiano. So I used to speak fluent in Italian when I was in Italy for the Olympics. But I think that's awesome. So kudos to you. Why don't we, Jeff, if you can share screen, I just threw up a serratus anterior anatomy image. Okay, so if everyone can see that, it's called the serratus anterior because it looks like a serrated knife, the way it articulates on the ribs, and then it goes around to the back, and it goes on to the underside of the shoulder blade. So this muscle plays a big role in keeping the shoulder blade and all the shoulder function very harmonious. Okay, so obviously if you have any misalignments with that shoulder blade, if it's tilted or rotated in any different way, then it's going to affect the firing of the serratus anterior, because this serratus anterior, what it is it's a bridge between the ribs and the shoulder blade, right? So that's a lot of what it's doing, is just creating that harmonious interaction. So if we start to distort the shoulder blade, then we are affecting that length tension relationship. So I just want everyone to have a good overview of that. And then the other thing I'm really big on looking at is this here. This is a nerve here. That's the long thoracic nerve. Okay, so we want to make sure that nerve eventually goes under the collarbone, goes up into the neck. So we want to make sure that there's no pressure on that nerve. So one of the things I'm big on for that purpose is I'm big on neck hygiene, because if there's any pressure in the neck, it can affect the neural conductivity going into the serratus anterior. And I know I'm starting right here because I know that it's not common for people to think you got to check your neck if you have serratus anterior problems. Most of the times people will talk about, you got to do decline push-ups, decline press, overhead presses, and different exercises like that. And all of that stuff's great. So I'm assuming that at this point, if somebody's asking this kind of question, they kind of understand the basics, and we need to go a layer deeper in terms of understanding what missing links I might be able to provide for you to help you win the day for your clients. So one of the things to consider is bad neck posture is associated with this. So if I'm working with somebody who has serratus anterior issues, I'm getting them to do things like neck wipes just to free up if the nerves are getting caught between the scalenes and the side of the neck. So that's like a mandatory thing I'll do if I'm trying to optimize function of the serratus anterior. The other thing I want you to think about is, I want you to think holistic about the entire posture of the body. For example, if somebody has arches that collapse, it's associated with a compensatory collapse all the way up the kinetic chain. And that will affect the length tension relationship in the shoulder blade, the ribs, serratus anterior. So very highly associated serratus anterior problems with function and flat arches. So I will often defer to things like pigeon heel raises and stuff like that to exercise the tibialis posterior to help elevate the arches. So I'm working with the feet and I'm working with the neck. Then after that, I might try to straighten out kyphotic posture. So if they have rounded upper back posture, that's going to affect the articulation of that muscle. So I'll give them exercises to help straighten up the upper spine posture. And then so we basically want to get them out of a slouched posture. And then another thing I'll do is I really focus on the hips and pelvis, because any sort of distortions in the hip and pelvis, and we've got fascia that runs to the shoulders. So I just want to make sure we're not creating like a tug anywhere else in the kinetic chain. And then another thing that's big for serratus anterior is prioritizing the external obliques. And I don't hear people talk about this much, but the external obliques will blend into the serratus anterior through a lot of that fascia. So if you think of these different lines of connective tissue and the whole chain of muscle and connective tissue, we really want to optimize the external obliques. Now, does anyone have any thoughts or ideas in terms of just throw it into the chat on what I mean by that, or how you might address the external obliques?
Yeah, so pop it in the chat there, guys, if you have an idea on how you can address that. And let's see, we've got a follow-up question here that I'll just feed to you while we're waiting for people to pop in their answers. Is one of our watchers wants to know how can training proper breathing patterns aid in the activation and stabilization of the serratus anterior?
Whoever asked this is spot on. Because, if you take a look at proper posture, inverted breathing patterns, different breathing patterns, shallow breathing patterns can kind of cramp our posture. So what it does is it can actually affect the posture we're holding ourselves in, and that can have a negative impact on serratus anterior. So if you do recognize that somebody has poor breathing patterns, you might want to open them up with some deeper diaphragmatic breathing, because that will put if you think of the joints and the muscles and bones like gears, it'll line up the machinery so everything can work better. It would be very rare, actually, and I think breathing is a good point. I think breathing really affects like everything. And so I think that this point, not only can we share it as a positive thing to consider for the serratus anterior, but I think it's really relevant to just about every exercise on some level. So I think, it can't be understated the importance of just knowing how to breathe with good form. Because if you're doing that with bad form, it's really hard to be effective on any exercise thereafter, because you just don't have the physiological stabilization. You're in a deranged posture, and to be able to move well from that disadvantaged starting point puts you behind for sure. So whoever said that, virtual high five. I think you're bang on with that. Excellent point. I like to do now as far as external obliques, I like to do a lot of unilateral cable work. I'll do like one arm cable press to blend in, and with a little bit of a punch at the end to blend in a little bit of serratus anterior, work that whole chain with the external oblique. So I like to bring in like one unilateral exercises a lot. And then in general, I'm a big fan of bear crawling. So crawling on the ground with your hips up high for serratus anterior, dumbbell pullovers, cable stiff arm pull downs, ab wheel rollouts like decline push-ups, a lot of these different things. If they have good shoulders, then I'll give them overhead presses. I mean, sometimes they have an underlying dysfunction that isn't great for that. So those are a lot of the different strategies that I incorporate when dealing with the serratus anterior. I find a lot of people will jump to just serratus anterior work, but then they don't get the results they were looking for. And I certainly made that mistake for years. And, over my 30,000 hours, I mean, everyone can learn everything. You can take the 30,000 hour route, or you can learn from other people's mistakes. And I'm hoping that just sharing some of my mistakes and being effective might help you save some time so you can get those results now rather than having to take the long route. So once again, I guess just to summarize, really focus on good, proper neck posture, because all of the circuitry is coming out of there. really focus on good good upper spine posture. So we don't want to have a really rounded kyphosis. We really want to have more of a straighter spine, because then the way the shoulder blade sits on the rib cage will be more optimal. Look for the arches. Just make sure that they're not collapsing somewhere lower in the kinetic chain, because then everything above is collapsing. And then apply, once you get sort of these elements mixed in, then I start to apply some direct serratus anterior strategy. So hopefully that answered the question. If not, like, just throw in anything else if there's anything else you guys wanted to ask on this particular subject at the moment.
Yeah, that was awesome. So that gives Kyle a lot of great ideas. Hopefully that helps him with that. I'm going to jump to a question from Joanne. So question 5 from Joanne for you. And so Joanne sent us a question. She's looking for some advice for clients with knee arthritis. So what sort of guidelines or advice would you give to Joanne for training knee arthritis clients?
I would say this. I'm just gonna, from a place of intuition, I'm just gonna tell you what I think is the truth in terms of where you need to start. You need to start with finding out how willing they are to do the work. In any arthritis case, how willing are you to do the work? It takes work to get better. How willing are you to do the work? I start there. And the reason is because a lot of times I'm looking at optimizing like their diet and other factors with arthritis to get the biggest results. The training, I think, is maybe 15, 20% of it. And I think 80% is like diet and lifestyle. So especially with everyday people, right? Like, we're not talking about pro athletes and stuff, then maybe the ratio is a little bit different. Maybe it is more of an issue there. But I like to start off with just sort of an overall anti-inflammatory approach. So that being said, what I would do is I would have them using probiotics every day, if not already. And that's why I said you have to find out how willing they are, because dysbiosis or an imbalance in the bowel flora is associated with arthritis, right? I would have them cutting out the sugars, cutting out the grains in particular. This is grains is one where I would have somebody rate their symptoms, cut out the grains, and after 2 weeks rate again. And you'll find it's like almost always improved by, at minimum 20% in 2 weeks. So getting them to cut out a lot of these things that might be contributing to inflammation in the body. I cut out dairy for the most part too when they're doing this. I also focus on optimizing dental hygiene. That might sound weird, but when it comes to arthritis, there is a connection, okay? So what I would do is I'd have them look at doing things like flossing. I'd look at how much they're brushing their teeth, and I'd maybe have them consider oil pulling. And oil pulling is one of those things where you're sloshing around coconut oil in your mouth and you spit it out after. And the idea is that, our teeth are very porous, and a lot of these microbes can hide in the teeth. And the oil, you might notice if you put oil in water, the oil kind of collects together. It's almost like a vacuum effect. So oil pulling kind of pulls out, in a lot of the virus and bacteria, they got a lipid bilayer body. So it kind of like the oil attracts the fat of these things that are in your mouth that are harmful, because having poor dental hygiene is associated with aggravation of arthritic symptoms and the presence of arthritic symptoms. So, but that's just a few examples off the top of my head when it comes to arthritis that are non-conventional. But I'll tell you that piece, as always, working with clients, made the biggest difference. Changing up the diet, getting rid of the junk in the diet that might be inflaming them. The lesser piece is that I try to think about, how can we maximize return on investment for each knee bend that client does? So I try not to get them to do 1 million knee bends. I don't have them do traditional cardio where it's like you're doing thousands of repetitions of knee bends on a bike or anything like that necessarily. I tend to just go on resistance training circuits, Tabata style, because I tell them rather than just do dedicated cardio, I want you to work your cardiovascular system with less knee bends, so we're not taxing the already compromised joints too much. So what I'll do is I'll just switch them on to all Tabata stuff. Don't worry about the cardio machines, because I'd rather have you doing squats, really intense set of squats to get your heart rate up. rather than a million reps on your elliptical or whatever else might just aggravate it through the sheer repetition of it. So that's one of the things. I mean, there's a lot of other obvious things that I didn't mention, such as, avoiding high impact. I'm a big fan of weight loss to help. So if somebody is overweight, I think that will actually help with the pressure on that area and knee pain. And there has been shown to be a correlation. I'll take a look at lifestyle and see if there's anything that's aggravating. There's a set number, and I forget what the number is right now, but it's so many repetitions of stairs a day is associated with knee problems such as knee arthritis. So, and then I think, like if you have just good sound training approaches and good common sense, the rest of the stuff is kind of easy. Like I think usually I'll get people to box squat rather than free squat initially so that they don't feel at risk of irritating something in their knee when they get to the bottom of a squat. They just feel safer and more comfortable moving forward. But at the end of the day, I just ask people, like, why are we doing this? I really build up the motivation. I feel like you can have when it comes to knee arthritis, you can have the best systems ever, but it all comes down to motivation. I've done this mistake, and just, give a thumbs up in the chat box. I've given somebody like the best system to get them pain-free, and then they went back and started to eat all the junk and got their body inflamed and the pain came back, even after we had it figured out. Like, has anyone else done that by any chance? Maybe I'm the only one, but
it's very interesting because, as trainers, we typically are looking for the magic exercise or series of exercises, but you started with all these lifestyle factors, right? Yeah. And so that might be the missing piece for a lot of clients or for a lot of trainers, the nutrition and lifestyle factors that is going to make a big difference with the client. So that was amazing. Thank you for sharing that. We got Joanne chipping in there. She is thanking you for those answers. She thinks that's a big key, and that's really going to help her and her client. She's wondering if it's okay for the knees to crack when they are squatting or lunging or moving in the gym. Is that something that's okay or not okay?
Yeah, I mean, sometimes you'll get the sounds coming from the joints, and they call it crepitus. My general rule is, if the crack has pain happening with it, then I cut it out. Whatever it is, I cut it out. Sometimes you'll get the odd crack and stuff like this, and there's no pain, and we could tolerate it a bit, but you got to realize the psychological impact on your client. Like, they may feel like it's wrong and it's uncomfortable, and you got to take that into consideration, even if it does seem like it's not really much of a risk. So in general, I try to avoid it as best I can. Anything that's going to get them to crack, I try to figure out different ways if possible. I may get them to do like a wall sit and do like wall slides. So they're like working their upper back while just doing an isometric for the legs, as long as that's not going to drive them nuts. I may mix in some stuff like that just so that I'm strengthening things up without psychologically agitating them through the cracks that are going on in their body. So I would say it's okay as long as there's no pain, but you also want to be mindful of not demotivating the client. And at the end of the day, I think that the arthritis piece is massively like mental and motivational if you want to be successful. I don't think there's a lack of success secrets on there. When people do everything I say, I find it's always like breakthrough success, right? With just tons of greens in the diet and fruits and vegetables and all these different, and nuts and seeds and just different things that would not inflame them as much as what might be normally in their diet. Like, I feel like that's the vast majority of it when I'm dealing with people with arthritis. So hopefully that gives you some perspective. And then I'd say, use your wise coach's judgment. Hopefully I gave you some perspective, but at the end of the day, your clients better than I do and better than anybody does. You are the reigning world expert on your clients. Every single person here on this call. I'm going to try to share with you some things that have helped me win, but you might find that you've got to tweak that recipe a little bit here or there, take this piece, maybe leave that piece. And all I'm trying to do here for you today is just help you out by giving you a bunch of stuff that you might be able to strategically implement, win the day with your clients and create some raving fans.
Awesome. So Polly's got a follow-up question for us on this. She has a client with bilateral prosthetic knees, and the whole lower body movement is poor. So squatting and lunging is something that they can't do. She's asking, where would you start? Would you start from the feet up or from the hips down?
Well, usually when I have somebody with that, I start with them on the floor, and I'm doing hip abduction, hip adduction, extension, and I'm building it up. And then I'll start to get them to do some standing foot exercises, but I'm not having them do compound leg exercises at that point. So I would say, to answer your question in the terms you put it, I would start with the feet, but I would get them to do all the lower body stuff, really focusing on the hips, get them to do it just lying down unilateral. Like that's typically where I'd start with a case like this. I've had this, and it's weird because, you know, you can get somebody to squat, but when they've got when they've got prosthetics in, like sometimes it's just not the same, the prosthetics. So you might notice there's a little bit of a clunk or a catch, or their form is just off. So I usually start with just building up the stability on the floor through isolation. And I might do that for 6 weeks, isolation, variations on isolation. And then I try to integrate it into the more compound movements. And the foot stuff I'll do the whole time, because they got to walk in and out of the gym. They're walking on their feet, and I'm trying to stabilize the foot and ankle so that they have that support once we go to the compound lower body movements. That was a brilliant question, whoever asked that. Because I've been there, and it sucks. It's like, what do I do? And I just use truth to experience. And I just know from having worked with cases like that over the years, I find the best success is just start them on the ground. You do the foot stuff standing, work your way to the upright exercises once they feel more comfortable.
Awesome. Well, that was from Paulie. So Paulie, thanks for the question. Okay, we're going to move to our next question. This might be the last one we have time for today. We have someone that has a client that keeps getting one-sided QL tightness, and they have checked the hips, they've assessed the hips, and they said that the hips are where they are supposed to be and they are working fine. So where should they start?
Woo! Do you got an hour for an answer on this one? Because it could take that long. Here's where I'd start. If I'm just to give you a little bit on this, and we can perhaps go over this question a little bit more in depth in future. I would start by getting greater clarity on the problem. Okay, really greater clarity on the problem. I'd want to know, what time of day is it happening? You know, is this something they experience first thing in the morning? Right. If it is, there could be some sort of a dietary organ connection. I'm looking at something more holistic. Is this something later in the day? Because then I'm looking at, you know, cumulative loading, right? So do they have a postural habit in which they, you know, you'll see this a lot with truck drivers and people who spend a lot of time in the car. They lean onto that door when they're driving. So they may be creating excess tension in that QL, right? If it's not correlated with a particular time, it could be like poor function and proprioception. You know, if it's nonstop, that's a whole other different issue. So I want to get clear on the personality of this pain. I would say we want to do like personality profiling on this pain, you know, and where is it traveling from? And a lot of reasons for this is I've seen so many different variations of this problem that was described. And that's why I think it's a great question, because I could probably answer this question in the next 10, you know, live webinar Q&As. And in one case, I did everything and it didn't work, like literally everything. And I had to send them out for like an MRI, and they found an infection. And so it was the infection that was causing the problem on that one QL. And they did a round of antibiotics, and within a couple of weeks, he was pain-free. And that person had it for like a year, right? And it had to do with a previous surgery they had. So I would say we want to get some context on when are they experiencing it? You know, where does it travel? What is the sensation? Is it a burning, numb, tingling, a shearing? Is it a dull ache? I want to know that. And I'm probably going a little bit too in depth here, so I apologize if I am. I tend to go there with a problem like this because I usually find the ultimate answers are in the details with something like this. If you've been checking the hips and it's already good, because usually I'm seeing that with a one-sided pelvic tilt, then I may also be looking at, you know, do they have some sort of an SI joint instability and the QL is stabilizing from above? Or is it doing excess work in the frontal plane because maybe you have a dysfunction on the glute medius on that side, And maybe alignment wise, things look good, but function wise, it might be a little bit off. I've seen this problem coming from the foot and ankle with a collapsed ankle on one side. I've seen it a lot from leg length discrepancy. So I would check somebody for leg length discrepancy. And I think that's probably all we have time for today in terms of touching on that one. Hopefully that gave you some different ideas for experiments you can run. I wish I could just give you the answer on this, but the point is it can be many different things, and you won't really know until you get greater clarity on how this problem is showing up.
Yeah, I think the powerful thing there is the need for further information on that assessment, and having a system of thorough assessments is really important because like you said, there's so much that goes into it, right? And that's why in our exercise therapy live courses, we use functional assessments because they tend to give you the most amount of the information in the shortest period of time so that you can really get down to the root of the problem, which is awesome. But hopefully that gives our question asker a place to start. We had a few questions come through in the chat about low back pain and things like that. We don't have time for it today, but we are going to continue to do these in the new year. And so if you keep tuning in with us and come back, we'll definitely get to all these topics in future webinars and live education series that we do. So we'll get there. Now, before we close off, want to know, what was your biggest takeaway today for the people that are watching? So everybody out there that's been watching us live, or even if you're watching the replay, we want to know what you got from today's seminar. So what was your biggest takeaway? Just put it in the comments there so we can see sort of, what you are going to apply and use out of this with your clients. That helps us guide our future education and the future questions and topics that we pick. What was your favorite part, or what was your biggest takeaway? Just pop it into the chat there, okay? So here's a really golden gem that I got out of today that I want people to apply, okay? And that was the lifestyle factors on the knee arthritis, because it's not just knees, but people have hand arthritis, wrist arthritis, shoulder arthritis, all over the body aches and pains. And the lifestyle factors and nutrition, if we're not doing that, it really makes the work in the gym moot, right? And so if you're a fit pro and you have clients with arthritis, make sure that you're investigating the lifestyle side of things and make that part of your holistic approach, because that is going to really help you get to pain-free clients long-term. Because if you're missing that piece, it could be a long battle. And so that was my gem for today that I want all you fit pros to apply. Everybody's got some different things that they liked with the neck. Carlos liked the neck, and Alicia liked the serratus work with the cable. So there's a lot of different things. So that's awesome. Thank you for putting that in. Guys, we want you to share this with someone that needs to hear it. You guys are health and fitness pros. You all have colleagues and coworkers, and some of them might have the same questions that were asked today about serratus anterior, about knee arthritis, or about, QL tightness, so make sure when we're done here that you share this. If you found it valuable, if you like the information that Brendan was teaching you today, share it with at least one colleague or coworker, please, so that we can help teach them as well too. Brendan.
Yes, we're trying to figure out how to help serve the community. The more you share, the more we do. So we have a hidden number on how many shares we need of this before we do more free segments like this for people.
Awesome.
And help us help you. And other than that, I have nothing. I'm sending out massive love and gratitude to all of you. I know this is a difficult and uncertain time for us all, but we're all here sticking together, making the best of it, learning together from each other as one team, one tribe, one family. So it's an honor and a pleasure to be part of your journey.
Awesome. So you heard it from him. Share it to their feed or tag them in the comments, and so they can get tuned into this. And so we can help, move the health and fitness industry forward together. Now, if you haven't got the Pain-Free Mobility Guide yet, guys, you got to get it. I'm going to put the URL in the chat after we post this up, and you got to get the Pain-Free Mobility Guide. So, Brendan and our team, we spent months developing the Pain-Free Mobility Guide because we wanted to give something of value for free out there to people, because there's a lot of gaps and misinformation when it comes to mobility and what's really going on there. And we wanted to make sure we answered some of those questions. So the Pain-Free Mobility Guide, you can download it. It's 62 pages. It's got an assessment in it. It's got a recipe builder for you so you know what to implement with your clients, because not all types of mobility are right for every client. Not only that, but it's got Brendan's 8 top secrets that you need to know about creating pain-free mobility. So if you haven't got that, you can download it. Or if you just head to our website, exercisetherapyassociation.com, a little pop-up will come up and you can register to download the guide. And so make sure you download that guide because it's super, super valuable. And last but not least, this is going to be our last live education for 2020 as we're heading into the holiday season. So from the exercise therapy team, myself, Brendan, and all the instructors, we want to wish everybody an absolute Merry Christmas and a Happy New Year. And we want you to enjoy the holidays with loved ones. And we're going to enjoy it. We hope you enjoy it too. So thank you so much for tuning in today. We're going to see you all guys in the new year with some more live education series. And Merry Christmas and thanks for joining.
Celebrate Christmas every day. Let's do this.